Live from the ABC 7 Broadcast Center, this is ABC 7 News at 5 on your side.
Right now at 5 o'clock, major developments in the spread of Ebola to the United States. From Texas to right here in Washington, we are tracking it all. Just days after the first confirmed case of the deadly virus appeared in Dallas, 2 Washington area hospitals now have isolated patients who are showing symptoms of the disease.
Now, those potential cases involve people who recently returned to the U.S. from Africa and are now at Shady Grove Adventist Hospital in Rockville and Howard University Hospital in Northwest Washington.
Jennifer Donnellan begins our team coverage tonight from Howard University. So Jennifer, tell us, what do we know now?
Well, Allison, Scott, I think the most important thing, especially with this type of story, we don't want to overwhelm or underwhelm our viewers. We need to be responsible in our reporting. You need to keep an eye on this, monitor the developments. But as of right now, sources are telling our ABC 7 DC Bureau Chief Sam Ford that no person in city authority believes that this particular patient at the hospital behind me has Ebola. Those sources also saying that the patient's condition is improving.
I didn't think it would hit here, but I'm glad that Howard can help.
Outside Howard University Hospital today, many found out from reporters about a patient who was exhibiting Ebola-like symptoms. Johnny Jenkins was thinking twice about entering the building.
I had to go get my medicine. I mean, I wish I didn't have to be here today.
While word spread outside the building, a hospital spokesperson explained via a statement that a patient was admitted in stable condition after traveling to Nigeria. The patient had symptoms that could be associated with Ebola.
Maybe a little bit nervous, but I think the hospital is very professional. I think they'll make sure it stays contained and that it doesn't spread any further.
Officially, the hospital said the patient was isolated and the doctors were monitoring his or her symptoms along with the Centers for Disease Control and Prevention and the city's Department of Health. That agency also released a statement saying at this time there are no confirmed cases of Ebola in the District of Columbia. Still, there were residents who didn't want to take a risk.
And I'm leaving.
And others, like these 2 pharmacy students who said they were keeping it all in perspective.
As long as you're cautious, it's not a big deal.
Now, we all know about this case of Ebola, confirmed case of Ebola in Dallas, Texas. And as have been reported, there were mistakes made. Obviously, people here are trying not to make those same mistakes. We were told via sources through ABC 7 Sam Ford that there have been up to a dozen cases where patients exhibited Ebola-like symptoms within the District of Columbia, but none of those cases turned out to be Ebola. Also, in connection with this particular case, with his travel to the area where he was, that is not a hot spot, we understand, for Ebola at this point in time. Reporting live from Howard University, I'm Jennifer Donnellan. Back to you.
Okay, Jen, thank you very much. Now, we're going to get more on that possible Ebola case in Montgomery County in just a few minutes. But first, we have breaking news on the U.S. response to the confirmed case in Dallas. Now, for the latest on that, we go to our Roz Plater live in the ABC 7 newsroom. Roz?
Well, Allison, with at least that 1 patient here in the U.S. diagnosed with Ebola and the possibility of others, the administration announced today it is ramping up its efforts to help stem the crisis in West Africa and try to stop the virus in its tracks, although some critics say that response has been slow getting off the ground. Now, the Pentagon announced today that it is sending additional troops to make that number as many as 4,000 to West Africa. The troops are going to provide engineering and logistics support. They emphasize they will not treat Ebola patients and that every effort will be made to keep them from getting exposed and get treatment if indeed they are exposed. Also today, we learned that the Centers for Disease Control, the CDC, has established 14 labs around the country that could test blood samples for Ebola with a turnaround time of 24 hours. But Virginia Representative Frank Wolf told our news partners at WTOP he thinks more needs to be done.
You basically need a person in the White House, call them an Ebola czar, call them whatever, who can coordinate this thing. Look at some of the top people that can do this. But right now, they're falling behind. And I think they have to be totally candid with the American people. First, we said there was no problem with the guy. Then they were going to monitor 20 people. Now it's up to 100 people.
Well, as for that patient he was just talking about in Dallas, Thomas Duncan, who tested positive for Ebola, health officials there now say that only about 10 people he had contact with are at any real risk. And then finally today, they found a company to clean the apartment he had been living in, someone to take out the bedding and clothing. They'd had trouble finding a crew because many companies wanted nothing to do with it. Another company didn't have the right credentials to do the job. We should also tell you that right now there is still a briefing going on at the White House of top White House health officials and NIH officials. And what they've said in part is that they are using the whole of the U.S. government and treating this as a national security priority, rallying the international community to help out as well. We'll have more as more of this comes out a little bit later. For now, I'm live in the newsroom. I'm Roz Plater, ABC 7 News.
And Roz, of course, ABC 7 will have continuing coverage on the U.S. response to Ebola, as well as all of the precautions being taken at our local hospitals a little bit later in this newscast. You can also get the most up-to-date information on that case in Dallas and really the worldwide response to the outbreak in West Africa online at WJLA.com.